Hi everyone, Dr. Virginia Ellis over here. I am going to be answering questions about dental services that many people have. So if you're familiar with our channel, do remember to click that like button. You know you're going to get good advice and great information over here. If you have anyone that you know that could benefit from this information, go ahead and share the videos with your loved ones and subscribe to the channel. All right, so here we go. I am, as you know, I do work here at my dental practice, Dr. Virginia H. Ellis, DDS Dental Corp. Also, you can look me up on the website, orindadentist.com. Okay, Dr. Ellis, why is dental health so important? Okay, so in dentistry, it's not just about your teeth, right? Your head is connected to the rest of your body, okay? Number one, several factors. It is your quality of life, okay? In order to live and thrive and enjoy life to its fullest, you do not want to be in pain. You want to be able to do your daily functionings without pain or suffering. If you have dental pain, many of you know what dental pain is like. It can be quite painful and get in the way of your life, okay? So the other reason is because it also affects your social life. If you do not have healthy gums, nice teeth, it's going to affect your smile. And as I've said before, your smile radiates so much about you. You do not have to be a certain height, a certain weight, a certain background to be a beautiful person with your beautiful smile. Your smile really shines through and lets people know who you really are as a beautiful soul. It really does help when you can smile and smile with confidence. You can really elevate how you feel and how you really present yourself to others, okay? Another side note is if you have a dental infection, it can kill you. It's not super common, but it can. I just recently had a call from a patient whose dad was in the hospital yesterday. He didn't take care of his teeth, and the infection went into his blood, and now he has this thing called sepsis. So sepsis is infected blood with bacteria from your gums and from your teeth. So you don't want to go that route. If you are in the older age group where you have, say, delicate heart valves, even if you're young, you don't want to have bad gums and a lot of bacteria from cavities because that can spread into your bloodstream and infect your heart valves, and that can kill you, okay? That's called bacterial endocarditis. Not a good thing to have at all. Or if you're older and you have a fake joint, like say a fake shoulder or a fake hip or a fake knee, that can, especially if it's been placed within 2 years, that can get infected due to bacteria from your gums or your cavities, okay? You always run a risk if you do not take care of your gums and your teeth in the way that you should, okay? That's why it's so important, okay? Many factors, your overall health, your social life, and your comfort to enjoy life to its fullest. What is healthy dental routine? A healthy dental routine will be brushing and flossing every day, obviously watching what you eat and drink. For those of you who like to do a lot of sports drinks, I'm not going to name any brands, but energy drinks, be careful with that because those are very acidic drinks. If you eat a lot of sweets, sugary foods, carbohydrates that the bacteria can ingest and release acids, that can predispose you to cavities. So you want to manage that. You don't have to knock everything out, but everything in due moderation. And the healthy routine will be floss and brush every day, and make sure that you are coming and presenting yourselves to your recommended recalls, kind of like a car. You want your car to last and not leave you stranded on the road. You got to bring it in to have maintenance recalls, just like we tell you to come in for your maintenance recall, right? We want to make sure you come in and that you don't develop complications by having us clean your teeth, give you advice on how to stay healthy, and taking care of any needs that you have with your teeth, okay, and your gums. So one of the most common dental problems are gum problems. One's called gingivitis, reversible gum inflammation. Periodontitis is irreversible gum inflammation, which usually involves loss of gum level, loss of bone socket level. That is very common. And also cavities on teeth, okay? Those are the most common problems. Okay, what services does the dentist provide? Well, we provide dental wellness care, obviously helping you stay healthy so you can live and thrive and enjoy your life. That's dental wellness. Will be teaching you how to keep your gums clean, how to decrease the chances of you having cavities. So that's wellness, health and wellness. Okay, restorative dentistry. Restorative dentistry is basically dentistry that we do to restore your teeth back to health and function. So a filling is a restorative treatment. A crown is restorative treatment. A crown is when we cap your teeth, okay? Kind of like this. This is for a kid, okay? The older people, the adults, we get white crowns, okay? Let's see. Restorative treatment of specific conditions. Okay, so something like if you're diabetic and you have high susceptibility to having swollen gums, that's very common in diabetics. We help you address those issues. People who have cancer and have very delicate gums because of the radiation or the chemotherapy, sometimes the gums get really sore, or sometimes their mouths become very dry and you get a lot of cavities. We do treat that, so that's a specific condition. People who have autoimmune problems, who have like very dry mouths, we take care of that. Another thing we treat is pediatric and family dentistry. Pediatric dentistry is kid dentistry. We help kids mainly prevent cavities. We're trying to get you guys to bring in your children by age 1. And it's not to drill and fill, and sometimes not even to clean teeth, right? Because sometimes these kids have very few teeth. It just depends on the kid. But usually to prevent your children from having cavities and having to undergo the experience of having to do fillings or they're so young. A lot of times you can have a child that doesn't need anything. It's great. That's preventive dentistry for pediatric patients or children. And then we have adult dentistry. And that's basically with adult dentistry, we have you come in every 3 to 6 months for your cleanings and exams and, do crowns, implants, fillings, whitening, all kinds of that stuff. That's more of like the restorative side, okay? Although bleaching is considered more cosmetic. Oral surgery is basically taking teeth out and using stitches, using implants, advancing the jaw, changing the shape. That's usually more of a specialized field where we will send it to the oral surgeon. Okay, the next question. How long does a full dental exam take? Well, in our office, we are very, very thorough. So do bear with us because that is a really important exam. That usually takes about 2 and 2.5 hours. However, once you come in for your regular cleanings, we schedule 1 hour for your exam. If you're out of here earlier, we'll let you out earlier, just depending on what you are presenting with, what kind of inflammation you're presenting with, whether or not you need x-rays, or if you have questions. We want to make sure that we answer all of your questions and that you feel like you've gotten value out of the cleaning, exam, and special individualized attention that you are looking for. How often should the average person go to the dentist? That is a great question. Usually, it depends on the needs of the person. For most children, it's usually once every 6 months, unless that child is in braces, orthodontic treatment. So when your child is in braces or an adult is in braces, whether it be Invisalign or the train track metal braces, it's usually once every 3 months, okay? Unless you have a medical condition that requires you to come in. If you have an older person that can't keep his or her teeth clean, sometimes they have to come in once every 2 months, once a month. Someone with a dry mouth sometimes has to come in once a month. It just depends. But for most people, most adults, it's usually 3 to 6 months, okay? A healthy person with no bone disease, no gum disease, no bone socket disease, really clean mouth, it's usually about once every 6 months. People with heavier situations of gingivitis, gum inflammation, or periodontitis, it's usually every 3 to 4 months. What is routine dental cleaning? A routine dental cleaning is when you come in to get your teeth checked and cleaned, okay? So that would require us using our scalers, those hand instruments where we take off the tartar, and sometimes we use a water device to clean your teeth. We call it a piezo in our office, okay? And polishing your teeth. And me coming over and checking your teeth, okay? And depending on when your x-rays are due, we will take x-rays. We will update your x-rays whenever that is necessary, okay? What does dental insurance cover? If you really want to know, dental insurance covers very little, okay? You should never determine what you need and what you will get done because of what your insurance covers. Because at the end of the day, us doctors and my staff, we work for you. We do not work for the insurance companies. Our priority is to take care of you and take care of you in your best interest. And we will go ahead and help you in any which way possible, maximize your insurance benefits, but never fall under the trap. It really is. I can only do this because my insurance only covers this. I can only see this doctor because my insurance doesn't cover for this doctor. You have to take care of yourself. Your health is number one. You are number one. Okay? I can't overemphasize that enough. Okay. How should I schedule an appointment for dental services? Very easy. Just call my office. Okay? My phone number here at this office is 925-254-4043. The website address is orindadentist.com. Okay? All right. If you like the video, which has really good information, go ahead and click, like. Subscribe to the channel for more information that I will be sending. Lots of useful and interesting videos. And share this video or other videos that you'll see on my site. Okay. I look forward to seeing you in the next visit. Until the next video. Bye.